a big group. You know, all this makes me think maybe it's something of the whole idea of public-private partnership. Maybe that's become a cliche. Maybe the new paradigm is public-private rock legend partnership. In fact, if you start to think about different rock stars adopting different government agencies, the possibilities seem endless. But lots of, you can think of it yourself, but lots of terrific work being done there, both by the finalists as well as all the government principals involved. So as we move now to our next round of apps demos, we're shifting gears. Remember, up till now, we've focused on apps that are focused on community health. And this next session is going to focus on apps that impact the consumer directly. We'll be seeing demonstrations of applications and tools that have successfully harnessed data to help improve health by empowering patients and consumers to take control of their own health and healthcare. I'm pleased to introduce now Dr. Gio Colella, co-founder and chief executive officer, and Ethan Prater, vice president of product development at Castlight Health. Welcome, gentlemen.
Is the microphone? Yes, it is working, so I don't need to. I'm short, so I don't like to be behind the podium. First of all, thank you very much. It's truly an honor to be here. Such a great group of people. Coming after Bon Jovi, we thought we would start with a video, right? So we could give you an idea of what we are presenting today.
There are no prices on anything here.
Oh, believe me, some of it's pretty spendy. Whoa, that's really gone up.
Okay, stop. I don't need both, just one or the other. It depends on the price.
Oh, that's called shopping. We don't do that here. Thank you for coming in. Your bill? Your version will be mailed to you in 30 days. Good luck trying to make some sense of it.
Okay, I can leave now. This is the situation, right? As of World War II, healthcare cost has been escalating, something around 8 to 10% above GDP, unsustainable. The only way we can hold costs back now is by transferring more and more costs to the employees, to everybody, to the consumers, to the people in this room, paying more and more out of pocket. As you heard from the Aetna presentation earlier, the numbers are astonishing. And this is, you know, this may be right. This may the people pay for a service, that's okay. What we find anti-American, almost un-American and unfair is the fact that we are asked to shop in an environment where there's complete asymmetry of information. We have no information of what we're paying for, what the quality of what we're buying, and who we're going to be seeing. And actually, sometimes not even if what we are really shopping for we really need. It's like the woman at the supermarket. I have no idea now in what other industry would you see something like this. That's why about 4 years ago, Todd Park, Brian Roberts, and myself decided to start Castlight. We like to define Castlight more than a company. It's a mission. It's a true belief. It's what we really believe is right now. We're creating a transparency tool, a transparency portal that will allow employees and consumers to shop in a cost-efficient way for the better healthcare. So let me show a little bit what this means. And I'm going to use a patient called Melissa. Obviously, this is a patient that we made up. This is our opening page. As you can see on the opening page, we have a Your Plan status on the right of the page. And you can see here, I can't really read that well, but if I remember right, it was $1,860 that she has left on her deductible. Co-insurance. And by the way, by clicking on these things, you can actually get an explanation of what all these words mean. Please notice that the prices on the left are all personalized to Melissa. And what we mean by that is these are the negotiated rates that providers have negotiated with her carrier, and they're personalized to her moment at the moment she's actually buying the healthcare services. So in other words, if I'm going to the doctor now, I will know exactly what I have to pay out of pocket. And then you can notice on more south there, on your recommendation, we actually allow her to understand what savings she can have. There are opportunities for shopping better. Like in any other industry, right? What airline ticket you can buy better? What's going to cost you less? So we have all that capture in the entry page. This is the page that she's going to use at a glance to get into her healthcare system shopping experience. Now let's do a search for her, and I'll pick a procedure, Ethan, if you want. Urinary tract infection is a very common procedure. The treatment is fairly well known to everybody. The search engine has natural language search, which means that even if she misspells it, we get there anyway. And here's the page that shows up. First, huge surprise for everybody. Look at this. She pays either nothing or $1,600. This is her out-of-pocket. So huge amount of difference. Now, up until Castlight existed, she didn't know if she would end up in the $1,600 or in the zero. Now look on the right, you have all the places where she can go, from zero to the most expensive, which is the emergency room. She still has your plan that explains to her where she is in her status, and she has a Google map where she can decide where she wants to go, where's more convenient. Now she can search by experience, cost, quality, and doctor. So she can, and distance, and the radius of distance where she wants to go. So this page gave her a complete view at a glance of one particular disease and what she's going to pay for that. Now, let's say that she wants to shop by doctor, so she needs to see a specialist. Well, first of all, let's pick a hard one to spell, dermatologist, something like that. Can you spell it? Good, okay. So our natural search engine will fix it even if we spell it wrong. That's one of the big things that as we were building this and we're doing consumer groups that we realized people, frequently the medical terms are complicated. Excuse me. So we're a dermatologist visit, here we go. Okay, so it shows up to her, series of doctors, what she's going to be paying. Here's the big surprise. Her out-of-pocket can go from $47 to $400. She has quality measurements of the doctor, consumer reviews of the doctor. She knows where the doctor is, and by clicking on the doctor, she can actually find out a lot of the usual things that you want to know about the doctor you're going to be seeing. Does he take new patients? Is he board certified? Where does he practice? What faculty positions does he have? And last but not least important, what hospitals he's practicing from. Now in this case, it's Memorial, right? Memorial Hospital. And she can go to Memorial Hospital. And here we've put together we aggregated data from HHS, Leapfrog, many different sources. We don't create quality data, we aggregate the best of the quality data that are on the market now. And as you can see, she can decide, okay, well, look at between national averages, this facility has these rankings, this doctor has these rankings, and the Leapfrog tells me this, so I feel pretty safe. And she can decide what doctors to see. So Melissa, at this point, has shopped for healthcare, an experience she hasn't had before. She made sure she could get the best treatment with the best doctor at the best price in the most convenient place. She also made sure that the quality measurements that were there are nationally recognized quality measurements. So in one shot, she had an idea of overall what her cost of care has been. She can, through application, plan for her care. She can plan for her pregnancy and decide how much she wants to spend, what doctor she wants to see, and where she wants to see it. By doing this, we've already launched the application. We have more than 200,000 lives. We've achieved very, very high levels of engagement. Let me say a word about this. We're up to 60–70% of levels of engagement with people using our service. We believe that the healthcare experience is not just about showing a price and offering an option, but is getting people to use it. So we've created the application in a way that is very user-friendly. It reflects the best state-of-the-art consumer knowledge from Silicon Valley, where we're based. And we're very proud of the level of engagement that we achieve from the consumers that are using our service. We've also been able to show savings that are very remarkable, and we will be proud to speak more about it with you when I'm finished with this. So I want to thank you very much, and I'm very proud to be here and very honored that you invited me, and thank you for spending time with me.